Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television. Reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, on the program today, we will talk about the importance of community participation in primary health care. Recall that when we started this program many months ago, we started with discussing the health system. I'm going to bring that conversation in the course of this program because the health systems talks about the composition of our healthcare as the National Health Act as well as the World Health Systems Policy of the National Primary Healthcare Development Agency prescribes. Many of us go to health centers, we complain about inadequate staff, we complain about lack of drugs, inadequate amenities, sometimes no water supply, sometimes rude attitude of some healthcare workers. But the healthcare workers as well sometimes complain about being overworked, sometimes complain about being old. There's a whole lot of things that we complain about on both sides. So we can complain till forever, but except we begin to take some of the actions as citizens and as communities that the design of primary healthcare has already put on our shoulder, things might not improve. So that's what we'll be talking about today. So I'll quickly take you through what the World Health System Policy of the National Primary Healthcare Development Agency, which is used in the governance of primary healthcare all over the country, prescribes for our primary health care. But let me start from the National Health Act 2014. It's the policy document that defined our healthcare system in section 1 and 2. And by that description, our healthcare system begins from the villages. Yes, villages. And it doesn't start from the health centers. It begins from the communities. So every community is supposed to, every village or community is supposed to have a health committee. That's the starting point. And these health committees are supposed to work with the health center if they have one. It's not every village that necessarily must have a health facility. But if they have one, they work there. If they don't have, there are still health interventions, outreaches that can happen within a village or a community. My question is, do you have a health committee in your village? Do you have in your community? If you don't, it means absolutely that your community is not interested in health and welfare of its members. So let me quickly take you through what the World Health System requires. The composition of the village health committees, or which is also captured as village development committees, is as follows. The village head should be the patron. So if you have a chief in the village or the community, if you have a traditional ruler, an emir, His Royal Highness, Eze, Kabiesi, Oba, whatever nomenclature you go with in your location, that's the patron. Then you now have a set of persons who are appointed to be members of the committee. Among those ones, they get a respected person who will be the chairman. Then a representative of religious groups, depending on whichever religion is being applied there, a representative of the groups should be in the committee. Women leader of the community or the village should also be there. The youth leader will be there. You have a literate person who will serve as the secretary of the group. If you have NGOs or community-based organizations operating there, they also have to belong to this committee. Officer in charge of the healthcare facility, if they have a health center or a health post or a health clinic that is public, that belongs to the government, the officer in charge should be in this committee. Then if you have private health facilities, they should also be represented. It could also be patent medicine vendors that popularly referred to as chemists. They should also be members of this committee. Others include representative of traditional healers, representative of transport organizations, Association of Okada riders or Keke, or National Union of Road Transport Workers. So these are people who should constitute a village or a community health committee. And what are the roles and responsibilities of this committee? They identify health and health-related needs of the village or community. They plan for health and welfare of the village or community. These are important. Identify available resources within the village or community and allocate as appropriate for primary health programs. A typical example of the primary health programs is health awareness, educating the community, which is a major function of primary health care. Primary health care is not just what happens at the health centers, it's also to a reasonable extent what happens at the community level, teaching people how to treat their water, how to wash their hands, how to keep their environment clean, how to also stop open defecation and ensure that they apply personal hygienes and practices, especially as related to our environment. Mobilize and stimulate active community or village involvement in the implementation of these health plans. This is really very important. Then another function is monitor and stimulate. I've mentioned that. Determine exemptions and determinants of drug payments, but provide funds to pay for the exemptions. What this is talking about is within the village, we know there are some category of persons that do not have money to buy anything. Many times we expect treatment to be free, but for it to be free, someone must pay for it. So if the government is not paying for it to provide it free, the community might say that there are some elderly people who are so poor that they can't afford certain treatments, and they will make money available for free access to quality healthcare for those category of persons. So the terms of reference for these village health committees or community health committees, they must meet at least once in a month. Monthly meeting, they must meet, and the record minutes of their meetings, their secretary is expected to be someone who can read and write well. The minutes of meetings shall be signed by the chairman and the secretary. The treasurer, they must get a trusted person to be a treasurer of that committee, shall keep accounts of incomes and monies. Let me also mention that if the health center is generating money, any money they generate should be to the knowledge of this committee that is representing the village or the community. And together they plan on how to utilize those monies and keep providing quality health services. The government do not expect that primary health center should generate money and send to it. No, it's for the community to own it, use resources, make decisions on how those resources should be used to make sure that the health center is working very well, not to be shared among community members or community leaders or committee members. No, it's not for sharing. It's to use and make sure that the health center is running very well. So it's been long monologue, you might say, on the program today, but that's the cross of message I want to pass. We are going to take a break, and when we return, I'm going to play a conversation I had with Dr. Nkata Chukwu, who is a lead at the Health Systems Consult Ltd, and also a health economist and a public health management expert. So that conversation talks a bit more around the composition and the functions of our health systems. As we talk about the budget for 2022 and we keep x-raying various issues around the health sector, we feel it's important that we refresh your knowledge on the understanding of our health systems. So let's take this break. We'll be right back. Dr. Nkata Chukwu, COVID has done a lot to our health system, a lot of damage. And since it started, there's been a lot of conversation around health systems, weak health system, and some people will be wondering, what is this health system about? how does it solve the problem in their primary healthcare facilities, and what does it mean that COVID has made it weaker? A lot of reports around rejection of patients, around people told no bed spaces. Some of these things are not new anyway, but it appears to have gotten worse. So our viewers would like to know what is a health system, starting from the ward level, and how can we make it stronger, leveraging on the increased, perhaps, health expenditure that may have been occasioned by the COVID-19 pandemic. And of course, we are going to be talking to the screen, on some of the slides that is going to be projected.
So our health system, why we say our health system was already not doing well before COVID is, you'll recall we were ranked 187th out of about 195 countries.
That was 20 years ago.
Yeah, in health systems ranking. A lot has happened. We can say, oh, we're better than we were back then, right? But if you look at the other matrices or the other indicators that show that there's been an improvement in the system, we've not done well. So it's difficult to say, oh, that was 20 years ago, so maybe right now we're within the top 20, we're within the top 50. Because
so what are some of those metrics?
So if you look at the fact that we still contribute to the second highest number of under 5 and maternal deaths globally, just second to India.
So in terms of women dying from pregnancy-related issues, we are number 2 in the world.
Yes, we're number 2 in the world, total number of women. The same with number of children under 5 dying from mostly, communicable diseases that are easily managed, some vaccine preventable and some others that are relatively easy to manage. So our health system, we can't really say we've improved from the 187th, because when the system improves, the outputs and the outcome, which reflects in the mortality,
in other words, the results are going to show that there's been
there's been an improvement. But we don't have results that give us any confidence that we've left that 187th.
I kind of agree with you, because the last 3 surveys that were done, the National Demographic and Health Survey, the maternal deaths, that's women dying from pregnancy-related issues, had not essentially improved.
Yes.
In fact, from 2008, it became worse in 2013, and 2018 became a little lower than that of 2013. But it's more than 500 women dying out of 100,000 live births. Yeah.
And over 100 children dying, out of 1,000. So, so we're still not, it's very clear that there's still a lot to be done. And the reality is, it's good you've run through the building blocks. We have roughly 4 doctors to 10,000 Nigerians, and even fewer nurses. So we have lower beds per 1,000 or 10,000 population than the sub-Saharan African average, and than even our neighbors like Ghana and some other countries who, GDP-wise, were a lot better than that. You would expect we should be doing better than.
But it says that in terms of human resources, it appears we are doing better than a lot of sub-Saharan African countries.
So when it comes to human resources, before we go to human resources, when it comes to total health expenditure, we're not doing badly if you look at the WHO benchmark. But that's when you look at total health expenditure, total. Now, over 65% of that total health expenditure comes from household and individual out-of-pocket expenses.
So that's the money we use to buy from the chemists, the money we pay when we go to hospitals.
Yes, so the money we spend at the patent medicine vendors, the pharmacy, the money we pay when we go to see the community midwife in the village,
the long
or the
list
hospital
that the pregnant women collect
has to provide
delivery.
the JIC, all those other things you have to buy, even in public hospitals where it's supposed to be free, and then you still get a list to bring some commodities. So all that money put together, we are actually funding roughly 70% of our total health expenditure. Now, our public health expenditure as a percentage of the total, we're one of the lowest in Africa. So when you look at the total, that seems to look good, but because you're funding it from the wrong source, a source that actually ends up impoverishing Nigerians. And
so what that means is, yes, we are spending so much, but let's assume that Nigeria has spent 100 naira on health. 70 out of that 100 naira is from the pocket of the citizens.
Yes.
So the other 30 naira is you combine the budget, you combine the one from donor partners,
Yes.
or the private sector players
Yes.
who are,
Yes, like employers who are, paying on behalf of their employees and all that put together makes up 30%.
This looks like a good time to look at the screen and try to explain this with some diagrams. Yes, introduction to the World Health Systems. There's a lot of information here. And
so I think, well, the good thing with us in Nigeria is when it comes to policies and strategies, we're not lacking. We have some of the best policies and strategies in the world for all sectors, particularly the health sector, where, at least we're privy to a lot of what is out there. Yeah. Now, the health system is structured across 3 levels: the primary care level, the secondary care level, and the tertiary care level. Okay. At least in Nigeria, we've not gone into the quaternary care level.
So which ones are the primary?
So the primary care level is where you get your basic your basic services that are mostly outpatient, where you're not on admissions with complications and all that. And those are provided within the communities and within the primary healthcare facilities that are made up of health clinics, outposts, and primary healthcare centers. Yes, so the dispensaries and all that. So from the community up to that level. Once you move from that level to your general hospitals, or the equivalent of general hospitals in the private sector.
District hospitals or cottage hospitals.
And even private facilities where they now offer inpatient services and some certain specialties and all that. You are at the secondary care level. When you now get to the level like the tertiary hospitals, whether public or private, where you now have specialists,
like the teaching hospitals.
Like the teaching hospitals, the federal medical centers, and some of our private hospitals, where services are now segmented by specialties. You are now at the tertiary care level. Now, the primary care level is really the bedrock.
Yes, and that's what this system talks about.
Yes. So the World Health System is Nigeria's system for delivering its primary care services, right? And why World Health System? This was adopted in 2001 by the National Primary Healthcare Development Agency as the country's strategy for delivering primary healthcare, right? Yes. The reason why we use the word World Health System, in some places they use in some countries they use other names, is because Nigeria, the word is the lowest recognized governance structure, So the ward should be responsible for organizing those primary care services. Okay. So within each ward, ideally, you should have one fully functional primary health care center.
Yes.
And then a couple of dispensaries and all that.
To promote full and active participation of ownership. There's a place they put about that
the functionality, yeah, that's under expected functional PHC in each ward. So each ward should have a minimum one functional. It shouldn't have only one functional, but at a minimum, worst case scenario, one functional. With a collection of other PHCs, primary healthcare centers and dispensaries and all that, right? Now, what we've also improved on is this functionality has now been expanded to not just be one public functional primary healthcare center, but one functional primary healthcare center, be it public or private. As long as there is that.
So irrespective of who is providing it.
Irrespective of who owns it.
Everyone should have one full functional. There was a study, I think 2017, by the Save 1 Million Lives program that looks at functionality of, they call it health facility assessments.
Yes.
And it said we have over 30,000 primary healthcare centers. Yes. And less than 10,000, about 6,000 or thereabout, that are the ones that could be said to be functional. Yeah. And that may have informed when federal government announced the plan to strengthen 10,000 PHCs across the country.
So in terms of how this World Health System is structured, right?
Yes.
You have the facility. So actually you have the community, and within a community, you have the facilities, right?
Yes.
And then the health authorities and the community leadership co-manage those facilities as joint assets that belongs to the community and the ward, and hence the World Health System. So what you see
that
here
means is the health centers belongs to the community or the village where it's located, and they are supposed to be a part of management of that health center.
They're supposed to be a part of the resourcing, the management, and the monitoring and evaluation of those health centers. So that's what this basically says. So where you have a facility management committee, it has community members. But then at the community level, you also have the village development committee, and then to the ward development committee and the LG Health Authority. So even with the facility management committee, you have the representatives of the village and the ward in those. So now that we're moving and advocating for DFF, direct facility financing, where facilities open accounts and their monies, their interest is sent directly to them. The chair of the village development committee or the ward development committee is a co-signatory along with the in charge of the facility.
Wow. You know, it will be interesting. We are going to put this slide out on our social media platforms, and I'm sure you're going to learn a lot from it. So the facility management committee doesn't appear to exist in many of the places. And if you don't take out anything here in this program today, note that every primary healthcare center that is in your community or village is supposed to have a facility management committee that is supposed to promote improvement and ensuring that patients have satisfaction, ensuring that pregnant women are addressed with respect when they go for immunization for their children or even for antenatal care. So primary healthcare minimum standard. I can see health infrastructure, human resource for health, service provision. These are like 3 of the 6 building blocks. Health infrastructure is perhaps appears to be where politicians or policymakers tend to do more in terms of building, painting, and roofing and all that. But could you speak briefly to that and, of course, the other blocks?
Okay. So basically, yeah, like you said, these are 3, even though a lot has been bundled into them. But you need to have these 3 available to be able to deliver any kind of primary healthcare service or any level of care in the first place. So health infrastructure is basically making sure that there is a building with the roof, a space that is not leaking, a space that respects the privacy of patients and the confidentiality needs between them and their care providers. And health infrastructure also should go beyond the building to the basic diagnostic equipment. You know, be it at the primary care level where you have lower technology point of care diagnostic equipment and all that, as well as the when you now loop in the other bits, which is the commodities bit, the commodities, the medicaments and all that. Now you need the human beings to be able to deliver service. In fact, the most important, in my opinion, is usually the human being and the money you need to have the human beings. Because a lot of services you can deliver at home. The preventive, promotive, and a lot of the primary care services, you can deliver even outside the facility setting once you have the right human being and the logistics and the commodities for them to deliver services.
Welcome back to Talking with Dr. Laz, your favorite health program on television. I hope you really enjoyed that conversation. You learned a lot from it. Conversation on our healthcare system. I thank Dr. Nkata Chukwu for sharing knowledge in that regard. Note that there is a number of policies. We have them on the Make Our Hospital Work website. If you check the makeourhospitalwork.org, you can get a number of health policies by the federal government of Nigeria and check out what is required. Also, Talk Health Nigeria and Make Our Hospital Work campaign, you know, with support from Open Society Initiative in West Africa, we are doing a radio program in Ebonyi State where we are sensitizing persons on the importance of community participation in primary health care. And the first step is village health committees. So before I close, let me ask you, does your village or community have a health committee? If you don't, the time to start is now. Thank you very much. See you same station, same time next week. Keep playing your part to make our hospital work. Bye for now.